So often, adult literacy flies under the radar. People don't think about it.
It can be a way for them to just keep moving forward. It doesn't matter where you come from.
Literacy allows somebody the opportunity to flourish in the community. And I think Corewell believes in that. That's why we're a partner in this work.
We need more healthcare workers. And so we're solving a problem by, on so many levels, supporting folks getting in there.
I'm the general medicine student in my country. This is opportunity to come to United States and continue my education.
Many people are finding this beautiful way, this amazing way to be in contact with healthcare system again and help people here, help our patients.
The healthcare industry is experiencing a talent shortage, but literacy classes may be the key in bridging the gap.
That's right. We're taking a look inside a program between the Literacy Center of West Michigan and Corewell Health, offering hardworking immigrant communities a pathway to professions in healthcare through language. Healthcare workers are in high demand across the country, and Michigan is no exception, with the Michigan Health and Hospital Association reporting 23,000 open positions in its 2025 review. Corewell Health is the largest healthcare system in Michigan. It boasts around 64,000 plus workers and serves more than 1.2 million patients.
So we are planning well for those gaps, but at the same time, we can have some shortages which cause overtime. It can cause to burnout, so we have higher turnover. We have, and many large corporations have, a very robust way of thinking about competencies. We see a skills gap, like there's not enough employees in the state of Michigan for the needs, especially in healthcare, that we have. I think it's our job as leaders to think about how to look at that differently with more creative lens.
We have this program that we've led in the state of Michigan on. It's called Integrated Education and Training. And it's a recognition that a lot of adults struggle to get short-term trades and training certifications because they need a little support in adult foundational education. It's estimated that over 50% of Michiganders read below 9th grade, and almost a third read below 4th grade in English. So those supports are really needed for most adults. We had also done some contextualized ESL for frontline workers at Corewell Health. So together we had kind of conceived that, what if we removed not only English as a barrier to this training, but employment as well? What if folks became employees and they got paid, and half of their time they would be getting this training, and it would be contextualized to improving their language around it.
The Literacy Center of West Michigan launched its collaborative pipeline program, Michigan Impact, with Corewell Health in 2023, connecting immigrant and English learning adults to high-demand careers in healthcare. Through statewide grants, it combines paid entry-level employment, English instruction, and credentialed training in hopes of building the healthcare workforce of tomorrow.
So can we talk about the payment that people get when they come in here? Because for a lot of folks, practicing English proficiency is something they do after they put the kids to bed and after they have a hard day's work. This really kind of disintegrates some barriers.
The resource that's small is not just money, it's time. And I think all of us as adults, we can relate to that. Like pursuing your own education really almost feels like a luxury once you are in that role of adulting. We design our programs to actually meet adults where they're at in their adult lives, both in location and in content. So it's not an afterthought. It's not an extra project. It's not something they need to reserve more bandwidth in their life. And with the employment piece, it's like, how can they get paid too? We're so moved that people who are so loving and so mission-centered on doing this work want to do that work, and it's here, and it's a high-needs position. The other part of it is that we understood what a huge talent pool there was with so many of the immigrants and refugees we are working with. You know, just anecdotally, we meet people again and again that, oh, I was a nurse in my home country, a doctor, a radiologist, and so we knew this all existed.
For women like Tabassum Amadi, the program means a right to education and an opportunity to go after her dream.
I'm the general medicine student in my country. I study in Afghanistan just 4 years, and also I am earning a certificate of ultrasound, and also I worked in a hospital in my country almost 3 years. But I'm not finished my study in here, because when Taliban came to my country and came to power, they do not allow the girls to go to university, to go to school, and close the doors, and do not allow to education for girls. Yeah, Literacy Center is the center that you can build a future in here, and you can grow your future in here. I want to improve my English at the first and continue my education, and also continue to work to find the best work and best job to healthcare. It's my dream to work in the healthcare and to help the patient. It gives me happiness like this. I feel very good to talk with the patient and solve the problem of the patient.
Were there any areas where when you first came to the US it was like, whoa, what's happening? Everything's new and this is kind of hard?
When I came to United States, it's new. All of the communities changed, not same of my own country. And in here you should speak English. When I come, for me it's so difficult to speak to another person and solve our problem. After when I come to Literacy Center, day to day my English is good to high, and now I can communicate with in the work and the other person in the hospital. We can talk with the patient.
What does it mean to you, can I ask, just being a woman and going after this field, which is something that the Taliban obviously took away the possibility of when they came to power?
I'm in the woman of Afghanistan that this is opportunity to come to United States and continue my education. But in my country, I have a lot of, in my classmates in here, is not allowed to continue education. This is my best opportunity to come United States and follow my dreams. I hope that the girls of my country to continue his education and to build a better future for all girls of my country.
For me and for a lot of the team and board and the learners that we serve, the United States represents an opportunity to pursue dreams and a future for your family that the current context at home is not allowing for. And Tabo is that story. It's that American story. And it's really gratifying to represent that legacy and aspect of the American dream and to support remarkable people like Tabo who have so many assets and make our country better.
While people like Emily come with years of experience, others like Jackson Fortune are getting to know the industry.
Right now, I'm working as a CNA at Corewell. Yeah, I'm working it's a good opportunity for me just to start this career. In Brazil, I've been work in a public hospital as interpreter. And I already, after high school, have in mind to get involved in the healthcare field. I'm just waiting for the exact time to start, you know. And so right now, I'm really happy for this great opportunity for me to start in the U.S., get to know the field, and see what can be better for the future. I was born and raised in Haiti. I have all of my siblings who already live in the U.S. for many years, and then we didn't meet each other for many years, so we talked to each other, and I decided to come to the U.S. to join each other. And I just sit with my family and my daughter, and we're here in the U.S.
Was it nice to have, when you came over, people who are already established, who'd kind of immigrated here before, who can help you kind of navigate like a new country?
Yeah, it was a little foreign for me just to start, but my sister who lives here in Grand Rapids, she helped me a lot. When she first came here in Grand Rapids, she took some classes as well in Literacy Center, and she refers me to the Literacy Center because I realized that it was really important for me to improve my communication skill in order to get a great opportunity for the future. It was challenging, you know. I had to work a lot with my listening, mainly at the beginning, to work with my listening, because I remember when I first came, I went to a school with my nephew. I didn't able to hear anything the teacher said, so I realized that it was important for me to work on my listening skills in order to be able to listen. And after, I'm just working a lot with my speaking skill, that I'm still working on it, so it was important for me.
You are supporting your family, you know, you have children, one on the way. How important was it for you to be able to have a stipend, you know, here, to be able to have money for studying?
When I first came here, so I realized that I have to start, right? Even though I didn't be able to speak English well, so the Literacy Center helped me, and I just find this opportunity to increase my career. So I'm really excited and really happy for that. I realized that the fruit of, I can see right now, the fruit of consistency, you know, every day, just give yourself about 10-15 minutes every day, work on your fluency. So it's really important, yeah. If you have a goal you want to realize for the future, so don't be afraid to start, and we will reach it.
The Power of Language offers more than economic opportunity. In this program, it's a pathway to connection, a central point for humanity, and a place of belonging in a new home.
I think a lot of people, especially people who are monolanguage speakers, we have this idea that language is somewhat transactional and that it's, you know, just a utilitarian activity, but it's so core to our humanity, our self-expression, our understanding of who we are, and most importantly, our ability to connect with others.
And few connect quite as strongly as Maximo Sanchez.
I love healthcare. I love taking care of people. I love seeing patients. That's my passion. So, since I was a child, they asked me what will be my profession in the future. And since I was like 7 years or 8 years old, I said I'm gonna be a doctor because I like to take care of people.
Sanchez was a physician in his hometown of Cuba before he was forced to flee due to political issues, taking him to Venezuela, then Ecuador, before finally settling in Grand Rapids, Michigan.
Life there for a doctor is really, really difficult. We were like suffering different bad situations, no fair situations. But I decided to be a doctor because I love taking care of people. You can imagine these feelings that we feel when we are far from patients or we are not close. Fortunately, I found Literacy Center. My hopes were closer, and I started again to dream. They asked me to participate in this kind of program, and it was really important for me because even I used to know a little bit of English. I don't have enough knowledge related to the pronunciation, technical terminologies, and how to know what is the system function here in Grand Rapids. My co-workers and Literacy Center and the Corewell Health have a system that teach you everything related to culture, biases and everything. But my goal was, since the beginning, to learn about this culture and to show many things related to my culture that can help them. They always asking me, Maximo, why are you so happy always? Why are you smiling? You don't have, it's 6 a.m. Why are you laughing and singing? Because I love singing, laughing, and show my happiness and contagion someone else, because it's my way to help my team and help patients too. And I used to do that at home, and when I was working as a doctor with my patients, we were like a family. And right now I can't change that, because that is what I am. So that's who I am. And learning English helps me to do that.
Do you feel like your past medical background as a doctor has helped you be a better medical assistant?
I think every profession, in every place you have, if you are doing with all your heart, it doesn't matter if I don't like to compare them. Yeah. I feel like when I was working as a doctor, I feel like I was doing really great because I was doing with all my heart.
You've talked so much in this interview about helping people. I guess what makes you want to help folks? It seems like you were doing that in Cuba and you were fighting to do that again here. Yeah. Why is that so important to you?
Mostly because of my mom. My mom always taught me about helping others, that helping is better than be served, okay? And when I see a patient, I'm seeing people who need help. Need physical help, need emotional help, need everything, need a smile. So I'm always smiling, even my situation is difficult, I'm always smiling to broke these eyes that every patient is facing when they are coming to the health service.
Sanchez's smile travels from his face to patients, staff, and his family back home. But behind it shows a journey that's been hard fought towards his dream.
When you are an immigrant, you have to pass for many difficult issues during the travel, okay? I think most of immigrants never talk about that because they feel like maybe they are not ready to say that. During my travel to this country, I suffer from different kind of violence, you know. For example, when I was trying to go to Ecuador, I found the police, National Guardian, that they stopped me. During my travel, they took everything, took all my properties. They closed me in the room. The environment is really difficult that you feel you're gonna explode. Your mind is gonna explode at that time. You know what is gonna happen if you get back or come back to your country. So it was the worst thing. I just could pray at that time. I said, God save me. And then finally God did the job because I could go through the line of the country. But at the beginning, I work in a restaurant, like a restaurant. I work in agriculture, doing everything to survive. So the pandemic was running at that time, and everything was limited, and I had to work at very, very hard work. I remember once that I have to work in the agriculture for a while because every restaurant were closed, and I was working in a restaurant. And I have to work in agriculture to survive because we don't have anything to eat. We don't have anything. And I passed through that moment. My family don't know about that. It was hard. It was hard. To be close to many organizations, I have to search in Google everything to gain help. Because I was fighting almost by myself. When this program appeared in internet, because I was looking or Googling, I was searching everything, I said, that's my opportunity. And when I arrived here and I get connected with Literacy Center, with Corewell Health, I said, my God, that is the result of your hope or your struggling and your faith.
Today, he stands with his head high, championing his dreams not just for himself, but for loved ones back home.
But the situation in my country is really, really difficult, and every day is turning more difficult than the day before. And when we are in another country, give them hope and opportunities, and saying them that, did you see what I did? Mm-hmm. We have hope, we have opportunities here. So don't be worried, everything is gonna be all right. Because we know a different story when we were in our countries. So I'm right now working here, smiling in front of my patient, helping everybody. But at the same time, I'm talking to my family. How are you feeling today? You find this medication, how can I help you? Smiling them, even I'm struggling with everything. I'm trying to keep them with courageous and everything related to that.
When people see this on TV, what do you hope that they take from, hearing your story?
If someone wants to improve in your English and build a better future, the Literacy Center is the center you can find your goals.
You can say everything, you can do everything, you can grow up, even you have a willing, and you take the opportunity and you have equality.
I would say, don't be afraid to start. We know that at the beginning, as a non-native speaker, it can be challenging. Give yourself discipline, dedication, work on your fluency every day. Be familiar with the process, and it will be great for the future.
Support for Mutually Inclusive is provided by the W.K. Kellogg Foundation, the Fry Foundation, and by viewers like you.